Welcome to a Homekeepers Special, Health Edition.
Hi there, I'm Arthelene Rippy from Homekeepers Television. So glad to be here and so glad that you are there. And I hope you'll stay with us for the next few minutes because you're going to hear something that really can be life-changing. We're talking about a very special product that I know that a lot of Homekeepers viewers are using. And the formulator of that great product is with me, Dr. John Young, my good friend by now. We've done a few programs together.
Many a program.
Yes, and I always like to bring the new viewers up to date on what we're doing. And so let me just introduce you to any new viewers. And you are a medical doctor.
Yes, MD.
I was just wondering, was there a point in your life where you said, I want to be a doctor?
Yes, when I realized that I wanted to actually get people better. And I just said, you know, I think I could do that. And so it started.
And you went to school and...
Went to school, learned the basics, got out there in my residency, and quickly learned that you give pharmaceuticals. We're trained like that. Mm-hmm. But after about 8 months, I realized that I wasn't getting anybody better. You know, I went to school to get people cure sickness and disease.
So you figured that out early on?
Well, it took me about 8 months to get there.
Well, that's early on. Because he has been a medical missionary, and you spent 15 years in the emergency rooms
Yes.
of hospitals in America, which we should say, that's the place to go when you have an emergency. We're not here to tear down the Medical Association at all, but things that you can do to make your own life better.
Well, I think American medicine is the very best medicine in the world for the acute problem. You're having a heart attack, you cut your hand badly, this is the place to be. Mm-hmm. But for the chronic diseases, mm-hmm. diabetes, arthritis, hypertension, what we're doing is we're taking an acute treatment. Here's a drug, get the pressure down, but we're keeping it on for years and years and years. There's a lot of side effects to those drugs, and what you find is you just keep adding more medicines along the way, and you're not really curing or getting to the root of the problem. And that's what I figured out. And I just started looking at, how did the old doctors of years ago treat these diseases, and started looking at the basic biochemistry, physiology textbooks, some of the Nobel Prizes, mm-hmm. and realized a lot of the answers are right there.
Well, Dr. Young, I didn't know that till today, that you kind of figured this out 8 months into it, but then it was a journey to figure out the problems and how we could make it better, and some amazing testimonies. Some of them we've had on other programs. But in drawing from our former programs and conversations we've had, you deal a lot with autoimmune diseases and just an inflammation. That's a real big one. And your slogan is, treat the cell, heal the body. Right. Now, is that true with every disease? Every disease, the cell is involved?
Well, pretty much so. I mean, I can't think of a disease where cells are not involved. Mm-hmm. Even injuries, automobile accidents, it comes down to breakage of tissue, breakage of cells. And what I learned from reading the literature was this. It all starts with an inflammatory process. And what you want to try to do is stop that or nip it in the bud. And a lot of Americans will do, well, I've got inflammation, I'll take Motrin or Advil or Tylenol or aspirin, which are fine, but you take them over long periods of time, you have a lot of side effects. GI bleeding, just feeling lousy, and they lose their mm-hmm. effectiveness. Any drug you take over time loses its effectiveness. Mm-hmm. So what I did is I realized that the 1931 Nobel Prize in Medicine talked about inflammation, combining an omega-3 oil with a protein. You have to emulsify it in a protein.
Boils down to those two things, right?
Yes. And the Germans were pretty smart, still are. Mm. And so we started doing that. And what I saw is that we started bringing down the inflammatory response. The other thing is I needed the protein to really heal, to repair. You know, everyone says, I'm eating a healthy diet, you know, salads and organic fruits and vegetables. But where's the protein? Your immune system is all protein. To repair anything, I need a protein. So the 31 Nobel Prize talked about this, and a lot of people know it as the Budwig cocktail. And I started incorporating it in my practice, and it started out with diabetes, and all of a sudden people are cutting back on their diabetic medications, and we're reducing.
It's a huge percentage of your practice for type 2 diabetics that actually get off of all their diabetic meds.
Right. In our study, about 70% of them were off all or most of their drugs within 2 to 3 months. Hypertension, diabetes. But then I started looking at the arthritises. As America ages, we have more arthritis. And I think the best example is I had a lady with polymyalgia rheumatica.
Never heard of that one.
And I don't even know how to spell it. But
I'm impressed you could say it.
Think of arthritis in every single joint of your body, even your jaws, and talking about, Doc, even rolling over in bed, I cry out, it hurts so bad. And I said, well, there's an inflammatory response. Let's put you on the cocktail, the Young Shake, the Budwig cocktail. And she comes back 2 weeks later, and I put her on this twice a day. She comes back 2 weeks later, and she's talking about something else. And I said, Marjorie, I thought you said your arthritis was so bad. Oh, that cocktail took care of that. Let's go on to other things.
Wow.
So, but it's trying to lower the immune response or the inflammatory response without destroying the immune system. We're seeing a lot on television about these biological drugs, Imbral and things like that, and they reduce the inflammation, but they knock out the immune system. So we're seeing big increases in cancer down the road.
So this kind of takes care of both of those things for a lot of people.
Because I don't want to knock out the immune system. We need it to fight disease.
Yeah, now actually this formula, and I read about it before I met you. That was one thing. I already know about that. This German doctor, lady doctor, turn of the century, but she did it with cottage cheese and some fish oil or something. And what he has done is taken this very, very basic formula, because he says he's always reading the old guys, which is really refreshing because everything is a brand new pill, and then 10 years later, sometimes they take it off the market. But he has, and let's take just a minute to say, what have you done to improve that cottage cheese and oil combination?
Well, we talked to the Budwig Institute in Germany. My old partner was German, and they would speak. And a few years ago, they found a way to make a low-heat whey protein at about 130 degrees. Most of the whey proteins you see out there, they're processed at 200. All the lactoferritins, all the good part of the protein's gone. And we used that, and then we used 9 parts flax, 1 part fish oil, per the Budwig folks. And then we used fruit of the spirit because it helped with taste, but I needed alkaline minerals. And we started using it, and people started getting better.
Little drops. So he's taken an old formula and greatly improved it. In fact, I want to show you what that is in just a second, but after you see that, you are going to hear a testimony from the father of a young girl who had a very serious arthritis from the age of 2.5. Just a story that just about took my breath away. And this girl is fine today. You're going to meet her dad in just a minute. But before you do, I want you to just see a real concise story of this marvelous young power shake. Take a look.
Something old and wonderful has just become something new and improved. More than 4 decades have passed since the discovery of the miraculous healing combination of protein and flax oil. The legendary doctor and scientist Johanna Budwig discovered that this simple formula had a profound effect on blood cells vulnerable to disease. Since most chronic disease starts at the cellular level, many consider this a major scientific breakthrough. Enter Dr. John Young, founder of Young Foundational Health Center. Dr. Young's vast medical experience at home and abroad gives him an elevated status in the field of health today. Dr. Young reached a point of frustration in his career as the prevailing conventional wisdom in medicine was a tendency to just treat the symptom with medication, never getting to the root of the problem. This frustration led him to a detailed study of the work of Dr. Budwig. By taking this basic formula, Dr. Young added the powerful antioxidants of fruit of the spirit and essential minerals to establish the Young Power Shake. His goal was to rebuild his patient's overall health from the ground up, starting at the cellular level. Take a look at these inspiring statistics.
Hal J., age 56, suffered from neuropathy of the legs and feet, and after 7 weeks on the program, his symptoms have decreased drastically. Millicent M., age 67, was on several diabetes medications, and after 9 weeks, she was taken off all of her medication. Tamara S., age 71, had severe hypertension and was taken off all of her blood pressure medications after just 6 weeks.
These testimonies offer proof positive the value of this timeless formula. Isn't it time for you to live your life in better health? Just call that number on your screen and request this amazing old but new tried and true powerful health enhancer, the Young Power Shake. Call the number on the screen right now to request the Young Power Shake. For just $149.95, you will receive a month's supply of high-quality protein, the special blend of flax and fish oils, those all-important alkalizing minerals, and the amazing antioxidant mix of biblical ingredients, fruit of the spirit. Call now and receive free shipping on your monthly order. Start living your life in better health. Call now.
All right, if you just tuned in, we're talking about the Young Power Shake, and every time I get with Dr. Young, seems like there's more just wonderful, wonderful testimonies. So I hope you're going to really pay attention to the telephone number that comes up on your screen. And now I am welcoming to this program John Hotchkiss, and he's going to tell you the story of his daughter. I believe she's about 10 years old now, and her name is Joy. Right?
She is actually just a couple days from turning 9.
And we're going to show a picture of your family. You have 3 girls.
Yep, Joy's the middle one, and in that picture she's right in the middle between us. So.
And I think we said earlier, a lot of estrogen in your family.
Yeah, Casa de Estrogena. That is certainly the name of our house. 3 girls, no boys, even the dogs are neutered. So
but you
we
know,
haven't got a chance.
Those girls love their daddy.
They are.
I
know.
Strong bond is that father-daughter.
That is right. They're going to take care of me forever.
John has a fairly new daughter, and I bet he's found that to be true. I bet she's a daddy's girl.
Yeah.
Just bet you. I just want you to tell the viewers the story of Joy, because I've never heard anything like it, and it should be so encouraging to anybody out there who's dealing with the same set of circumstances.
Yeah. Well, I'll start with her name then. My first daughter is Hope. And she was born right after 9/11, and we knew she was born a month after, and we knew that's what the world needed. And then we became pregnant with Joy, and when she was born, my wife had decided that she wanted to treat children as a physician, and so because children brought her so much joy, and so that was where Joy's name came from. And she has always lived up to that name. She has a wonderful smile and an effective laugh, and she's She's a great kid. And when she was 2 years and 4 months old, just a couple of days before we were due to move into our new home where we live now, she woke up one morning and she said, "Daddy, I can't walk." She was just old enough to get words out and, partial sentences and that type of thing. And I said, "Well, what's wrong?" And I just thought maybe her leg was asleep, or something like that. And she started grabbing her leg. And I thought, well, maybe it's not asleep, I don't know, but I'll just hold her for a little while. She'll just make breakfast with me, kind of had her on my hip. And sure enough, for the next couple of hours, she complained more and more that it really hurt. I couldn't put her down. If I did, it would just really, really hurt. So that began, that night she was in the emergency room. We ended up in the hospital for 4 days. They believed she had septic joints, and doctors really worked very hard to try to figure out what it was that was going on. And as a parent, it's extremely frustrating to be in that situation, when you know that you can't do anything to help your little baby. So one of us was obviously always there with her the entire time, and we it took a course of 10 months of a whole lot of doctor's visits.
Just to get the diagnosis?
Just to get the diagnosis, yeah. They believed it was septic joints, and then that they really thought there was something going on within the joint, that there was some type of infection in there. And so they did some trauma-related stuff, to get in there, and and figure out the problem, and injected her joints with gold at one point, and all these different type of things. And so we, about 20 miles from our house, there was a pediatric rheumatologist. We went to visit him. He's the one who initially diagnosed her and didn't really care for his bedside manner a whole lot. So we ended up traveling. In Florida, there were only three pediatric rheumatologists. At the time, there were only 2. And the next closest one was 2 hours from home. So now we found ourselves every couple of weeks, traveling a couple hours from home to get care for her. And it was a course of methotrexate, combined with some steroids and some other stuff.
Wow, powerful drugs. Really.
Very powerful drugs. And then, so we're constantly monitoring her liver and having to have eye exams done for her, and all the stuff that goes not only with autoimmune disorders, but also with the side
Sounds
effects
like a total
of the drugs.
nightmare. So you have a 2.5-year-old with, did they diagnose it rheumatoid arthritis?
The original diagnosis was pediatric polyarticular arthritis. So, which some call it idiopathic arthritis because they don't know where it comes from, and there are all these names floating out around there.
Well,
about
doctor,
it,
isn't that pretty young for a child that young to have arthritis?
Well,
it's not real common.
It's rare. It's not real common.
But it can
but
happen.
it does happen, and that's why it's hard to diagnose because you don't see it all the time.
So she's about 2.5, and she's almost 9 now, did you say?
She's almost 9. Yep.
Okay, at what point on this journey, we're talking about almost 7 years, 6, 7 years, how'd you find out about Dr. Young?
Well, we stayed on the traditional route, really, for 6.5 years.
Wow.
And until just not quite 4 months ago. And essentially, she was on Enbrel for 4.5 of those years. After the methotrexate and all that type of stuff, she was on Enbrel. She'd have a couple flares, during the year. We might have to increase the dose, do another oral steroid, an Orapred, or something like that, which would just knock out her immune system. She missed so many days of school every year, I just can't even begin to count. And so she burned out on Enbrel this March. Just didn't work anymore. Efficacy was gone. So they tried to start her on a new drug, a TNF drug called Remicade. And we were 2.5 months into the process, and it didn't seem to be working. It seemed like she had maybe just burned out on that entire class of drugs. That's
awfully young.
Pretty young. To
burn
it's
out.
like how many, what's going on in my mind is how many more choices are out there? If we're going to be treating her lifelong, we want her to live past 100. She started at 2. Do we have 98 years worth of drugs?
Yeah,
that
right.
was the thought that hit my mind.
Oh, that's
and
sad.
so, yeah, really. And so I, essentially, she had a major dose of steroids that threw her into tachycardia for a week. So her resting heart rate was between 140, 150 for 7 days. And I was so frustrated. During the 3rd day of that, I said, I'm not going back. I don't want to go back to this rheumatologist. I'm so upset. I can't do that. We need to find another way. And my CFO at work was familiar with John Young.
Wow.
Set me up with an appointment. And there we were. We went and met. So.
Okay, now how long ago did she take the first shake?
14 weeks and 1 day.
And how many hours and minutes?
Yeah.
Okay, and she was supposed to be here today, and she decided, I don't want to be on television.
She didn't want to be on TV
And
today.
I think any 8-year-old girl who doesn't want to be on television, she's not going to be on television, is she?
That's right.
I appreciate you coming in her place. So we got 14 weeks. How is she today?
Joy is really, she's doing, by the grace of God, she's doing very well, day by day. And
what about her meds?
She's not on any meds. This is the other one I left out, was that because of all the inflammation in her body, stuff going on in her gut, really, she was constipated for 6.5 years. So she was on a laxative every day. And we had to put it in her milk in the morning and give it to her. Yeah, and so, and if we missed a day, we knew about it. I mean, it was pretty torturous for her. And so one day, in the middle of the shakes, I was putting them in the shakes. I just thought, this is probably something she's going to need. I mean, I've learned so much in the past few months.
You learned something.
So I was putting this stuff in the shakes. I didn't tell this guy about it, but put it in there.
Put a little laxative in the
Put a little laxative in there.
Hey,
she was so used to it. It's flavorless. No problem. What's the big deal, right? Well, one day I forgot, because I was making sure that I got the few things in this shake in the right amounts, and just kind of getting used to that. And the next day I forgot, and the day after that I forgot. And on the fourth day I went to Joy, and I said, "Joy, is your belly okay?" And she goes, "Yeah, why?" And I asked her about her routine and did everything go okay, and she said, "Yeah, it's been fine." And she said, "Why are you asking me?" And I said, "Well, I haven't given you your laxative for 4 days." She goes, "Really?" Because everything's fine. She was totally surprised. We were all shocked. I called Karen. I texted her on the phone, and I said, "Hey, by the way, I haven't given her the laxative for 4 days, and she's fine." And everybody was pretty amazed. It was kind of just one of those side benefits.
What about her pain? What about her walking? Does she run and act like any other child?
Oh yeah, she does. Right now what we've realized is, because of the arthritis, and there's always been this underlying amount of pain that she's had, she has learned to actually move her hips inward a little bit, because arthritis for her has kind of had the effect of gravity. It goes to the lowest joint. Her ankles have been the most overwhelming. And so she's actually turned her legs somewhat inward. And so now she's missing some muscle mass on the hips. So now we're doing some physical therapy with her to build that back up. But right now, it's not a pain issue, it's a stamina issue. So we're working through that, and making sure that she gets what she needs for that.
Well, after all those years of powerful drugs, it might take a little bit. If you just joined us and you've been hearing this story about a young girl who at the age of 2.5 was found to have a very, very serious arthritis, was on tons of medication for arthritis until just 14 weeks ago, and that's when she began to take the Young Power Shake. Have you ever had a case like this before? I know that your caseload is very impressive as to the statistics for different diseases, but have you ever had a child this young with arthritis?
She's the youngest. I have some that are teenagers. And what's also interesting is that when I first saw her, even with all the medications, she was still saying that my pain's 5 out of 10, 7 out of 10. Yeah. And it was interesting. Fairly quickly it went to 1 out of 10, 0 out of 10. So, what's sad is you get these kids and adults just get used to the pain and think it's just normal. So it was encouraging to see that. The other thing that we did with her, what we do with a lot of our patients, is I think she had a little bit of an allergy to whey. And so we used an egg-based protein. So you can make some adjustments if there's an allergy condition there. Later on, we had her do some delayed allergy testing, which any doctor can do, and that's helped. But we use as our foundation, knock out the inflammation, and then let's work on the other areas.
There's a foundation
John's getting
there, right?
Physical therapy for, but you start with the basis.
What about your adult patients with arthritis?
Because
I know the type 2 diabetes is really astounding.
Right. With our adults, if it's really bad, we'll do the shake twice a day with the oil, because I need the anti-inflammatory, but you can only get it in there if you hide it in the protein. And usually within about 10 to 14 days, they are noticeably better. And that's where I start, and we go from there.
I'm curious. I got John here and John here. I am curious. Your wife is a pediatrician, and I'm sure she would be very, very careful to watch and observe and all. What were her thoughts on this when Joy first began to take it?
Well, yes, she's a pediatric ear, nose, and throat surgeon, and she's excellent at what she does for sure, and very scientific in her approach, which I've always loved and commended. She's the type A, I'm the type B. We wouldn't have it any other way. But I think both of us walked in as skeptics, yet skeptics that really wanted. We knew that there had to be another way, because we knew that what we were doing was not sustainable. That's what we knew.
Oh,
and so
yeah.
we have to reach out somewhere. Absolutely. So we both walked in as skeptics, and what was encouraging to me was, in the first, we got in there in such a rush. We just wanted to be there. We're like, okay, give us the new information. What are we going to learn here? And I had researched this guy some on the internet, kind of checked him out. So we looked at some of those things, but what he was talking about, Karen even said while we were in that first meeting, this is first-year medical school stuff. And that's when he clued in. He goes, you're a doctor? So, and it was, she looked at it, she goes, this is biochemical response. This is physiology. This is the stuff I learned in first.
Of course, you understood everything.
Well, she did.
No,
Joy and I are sitting there, 2 type Bs. What are we doing over here? ADD sitting in the corner. But she really got into it. And I'm telling you what, she pulled out some old stuff. She started getting on, on the internet, Googling what's all this stuff about. And sure enough, it certainly followed, a logical process. This is, for chronic diseases, this stuff works.
Right? Have another doctor kind of checking up on you.
Right, but the science is there, and if people would just take the time, or like I play tennis. I have a bad day in tennis, I go back to the basics. Racket back, watch the ball. Same thing I think in medicine. If you've got some of these really bad conditions, you go back to the biochemistry, Karen's physiology textbook, and start there.
Well, it just seems to me, a total layperson, that with all of these problems we have, that drugs are not the answer. There might be some short-term reason for an antibiotic or something, maybe that makes sense. But as I mentioned earlier, your mantra is treat the cell, heal the body. It just is so basic. And you told me one time what this does to the cell. We have about 1 minute. Does it encase it? Does it?
Well, it turns the cell into what you had when you were first born, which is a positive charge on the outside, a negative charge on the inside, like a battery. And when you have that, the body makes tons of vitamin D. And we got a vitamin D level on Joy, and got her vitamin D up. Vitamin D is a hormone, really, and it also helps with inflammation and the immune system. When you're on drugs that long, you want to build up their immune system. But it all works together.
Well, John, that's one of the most exciting stories I've ever heard, and I've interviewed people for about 30 years. I am so glad you brought it to us, and you tell Joy that she's welcome here anytime. I would like to meet her. I know she would do so well, and we'd like to hear her tell her own story. But for you, my friend, you have heard this, you have seen the information on how it all came together, and to take a basic formula, very, very basic, from the turn of the century, and Dr. Young has taken it and improved it and made it better. And of course, there's nothing in the world like a good testimony for a product or for anything in life. And let me tell you, we've had some really great ones on here. There are more in the pipeline that we want to bring to you. So I hope that you'll pick up the phone and order right now. And I hope to see you next time. God bless you.